Chapter 31. Diseases of the blood vessels. Blood circulates within the body through a special network of living tubes or pipes known as arteries, veins and capillaries. The blood leaving the left side of the heart is carried out to the tissues through aorta and its numerous large, then smaller, branching arteries, and finally through the tiny capillaries that actually feed the individual cells of the body. After leaving the capillaries, the blood travels in tiny vessels or veins that merge into ever larger veins until it finally reaches the right side of the heart. From there it is carried to the lungs where it receives a fresh supply of oxygen, and then back to the left side of the heart, thus completing the full circulation of the blood. In the arteries the blood is pumped under pressure which can be readily measured by means of a blood pressure cuff, the normal pressure being 120/70. Blood flowing through the veins is not under any pressure, but finds its way back to the heart with the aid either of valves in the veins and the contractions of our muscles or the breathing motions of the chest. When an artery is cut, the blood shoots out in spurts according to the rate of the heart. When a vein is cut, the blood runs out in a steady stream under no pressure. This is the difference between the two sides of the circulation, both of which are equally important to the body. Hardening of the arteries. Like all other tissues, the blood vessels are subject to certain disease conditions. One of the most important is known as arteriosclerosis or hardening of the arteries. This means a thickening or hardening of the vessel walls, due to the presence of calcium or lime. This hardening process is usually preceded by atherosclerosis, a kind of degenerative or softening of the inner lining of the vessel walls. The most dangerous places for such softening are in the coronary vessels. F18. 264 Diseases of the blood vessels. Of the heart itself, discussed on page 251, and in the arteries leading to the brain. This softening usually begins on the inner lining of the vessel and may extend through to the elastic portion, weakening the wall and perhaps forming an aneurysm, or bulging of the blood vessel walls. When the coronary vessels are involved, the disease is very serious, for it may result in coronary thrombosis, which accounts for more deaths than all other diseases combined. Causes, although the true cause of this softening and later cholesterol deposits 265. Hardening of the arteries is not yet clear. We do know that a high-fat diet, rich in cholesterol, is often related to this disease. Hardening of the arteries is more frequently seen in certain conditions such as diabetes, hypothyroidism, xanthomatosis, and nephrosis. People who are overweight are more likely to develop hardening of arteries. The type of fat is also important. Fats may occur as either oils or solid fats. Generally speaking, oils are unsaturated, while solid fats are saturated. These chemical terms refer to the arrangement of molecules in the fat. Saturated fats are found in all forms of meat, egg yolk, milk fats, and solid vegetable shortening. These fats tend to raise the level of cholesterol in the bloodstream. On the other hand, unsaturated fats, such as soybean, safflower, groundnut, sesame, gingerly, cottonseed, and maize oils, may ever lower the blood cholesterol level. This much is certain: people who live on a low-fat diet seem to have fewer strokes and heart attacks. But diet alone is not the complete answer, for some people with a normal cholesterol level have heart attacks. Again, there are differences between the sexes, men being more prone to develop arteriosclerosis. People with high blood pressure are also more likely. 266 Diseases of the blood vessels. To have hardening of the arteries, possibly because of the wear and tear on vessels due to the high pressure. Even emotional stress plays an important part. Heart attacks are more common during periods of mental and emotional stress, particularly in those engaged in sedentary occupations. Since this disease runs in families, hereditary factors must also be considered. Signs of trouble: when vessel walls are damaged by disease, blood can no longer flow freely through the vessel. Clots may then form, completely blocking the vessel or reducing the blood flow to the area. If the coronary arteries are involved, the patient may have sharp pains of angina or the much more serious condition known as coronary thrombosis. These are discussed on pages 252 and 253. When the arteries leading to the brain are involved, the vessel may burst, causing a hemorrhage into the brain tissue. Or it may be blocked with a blood clot, causing a cerebral vascular accident or stroke, with partial or complete paralysis of one side of the body. Many elderly people suffer from personality changes. They tend to become confused and forgetful and have no memory for recent events. There may be a series of little strokes with gradual deterioration of the brain tissue. It is a sad picture so often seen during the later years of life. Unfortunately, little can be done when the injury to the vessel occurs within the brain itself. However, if the blockage occurs in a large vessel in the neck, the clot can often be removed and the individual restored more or less to normal. All this is discussed more fully in Chapter 53. Pains in the legs, coming on after walking a moderate distance, often arise from narrowing of the blood vessels leading these areas. This is the condition known as intermittent claudication. If the vessel becomes completely blocked, gangrene may result and the toes become dark and cold. This is most frequently seen in cases of uncontrolled diabetes. If arteries leading to the kidneys are involved, the patient may suffer from high blood pressure, as shown on page 246. Treatment: although we still have no actual cure, we can do something to prevent the disease. Weight control is most important, particularly in those who are obese. A low-fat diet will help to reduce the weight and lower the cholesterol level of the blood. The use of unsaturated vegetable oils, such as cardi, gingelly, or groundnut oil, will also help. Fish oils also have a beneficial effect on the vessels, but it is best to avoid products containing large quantities. Aneurysm 267. Of coconut oil. Moderate exercise, especially walking, is useful. If the blood pressure is elevated, this should be treated as suggested on page 247. It is wise to give up the use of tobacco, particularly cigarettes. Above all, moderation in all things is essential. Certain medicines, such as nicotinic acid, not to be confused with nicotine in tobacco, and thyroid extract, seem to help this condition and lower the cholesterol level in the bloodstream. Someday a hormone substance may be found that will actually reverse this condition. Meanwhile, the wise will avoid everything that destroys the body. Good health depends largely on how we choose to live. Aneurysm. An aneurysm is a localized enlargement of a blood vessels, such as aorta. It may be due to inflammation as in syphilis, or to some weakness in the arterial wall caused by arteriosclerosis and hypertension. Large aneurysms or swellings of the aorta are usually due to arteriosclerosis. The most serious type of vessel enlargement is known as the dissecting aortic aneurysm. In this condition some of the blood may be forced partly through a crack in the vessel wall, thus opening a double channel and hindering the normal flow. Sometimes this condition arises from wear and tear on the arterial wall due to high blood pressure or perhaps germ infection or congenital weakness. Any injury to the chest, such as a knife or bullet wound, or a severe blow over the chest wall, may produce an aneurysm, either of the aorta or one of its larger branches. The condition occurs 10 times more frequently in males, perhaps on account of heavy manual work and the greater likelihood of injury. Aneurysms are often seen in the vessels in the brain, probably owing to weaknesses existing from early life. One of these aneurysms in the brain may gradually enlarge and press on surrounding tissues, causing serious trouble in the central nervous system, such as paralysis, or weakness on one side of the face or body. If such an aneurysm ruptures, there is likely to be a sudden flooding of the area with blood, and the patient may collapse and die. On the other hand, there may be only periodic oozing from the aneurysm, causing minor trouble in the area but continuing over a long period of time. Treatment: much will depend upon the location of the swelling. 268 Diseases of the blood vessels. Or aneurysm. If the swelling is located at the beginning of the aorta, syphilis should be suspected and adequately treated. If there is a large swelling in the arch of the aorta, it may be possible to remove the damaged segment and replace it with a plastic graft. The same is true if the aneurysm is found in the abdominal aorta or one of its larger branches leading to the lower extremities. Aneurysms occurring within the vessels of the brain can also be treated surgically, provided the diagnosis is made in time. The results are often surprisingly good. This is discussed more fully on page 504. Phlebitis. Phlebitis means inflammation of a vein, occurring most frequently in the lower extremities. One very serious form is known as milk leg, a condition sometimes following childbirth, particularly if there has been some injury to the pelvic veins. Trouble usually begins with the formation of a clot in one of the veins of the calf or foot. The clot itself may completely block off the vein, preventing any flow of blood from the area. Part of the Phlebitis 269. Clot itself may then break off and lodge in the lungs as a pulmonary embolus, a very serious complication that should be prevented if at all possible. In the leg itself there is usually considerable inflammation, especially around the vein involved. The inflamed area feels hot and may be red, swollen, and tender. Treatment: good nursing care is most important. The heating cradle described in the appendix is of value in treating this condition. The patient should remain in bed for at least 1 week. It is important not to massage the leg as this may force more clots out of the vein to lodge in the lungs. Hot water bottles or warm moist packs will usually relieve the pain in the leg to some extent, especially if there is a large area involved. Anticoagulants or blood-thinning medicines are of value in treating this condition and in preventing further complications due to an embolus. After about a week the patient can usually be allowed up, provided his temperature is normal and his condition satisfactory. He should continue on anticoagulants for at least another month. An elastic bandage will give support to the inflamed area, especially during the time the patient is out of bed. He should wear the elastic bandage as long as there is any tendency to swelling. 270 Diseases of the blood vessels. Surgery: if the phlebitis appears to be creeping up toward the heart, surgery may be indicated. The vein should be ligated or divided above the area of infection, preferably up near the groin, for it is difficult to know just how far the clot has already extended. Such surgery may save the patient's life. Prevention: all bedridden patients should move the legs as often as possible. It is not a good practice to allow bedridden patients to put a pillow behind their knees. This discourages movement and puts added pressure on the veins behind the bend of the knees, thus slowing the circulation. Patients with congestive heart failure should be instructed to move their legs often while lying in bed. This will help to keep the blood circulating. When they can be up and about, they should take gentle exercise, such as walking, to maintain good circulation in the lower limbs. Patients with varicose veins should be treated as suggested below. Varicose veins. As the blood returns to the heart, it passes through special thin-walled channels called veins. Unlike the strong, tough arteries, these vessels are easily distended. You can demonstrate that by pressing your finger on a vein on the back of your hand and watching it swell as the blood builds up behind it. Blood flowing from the head and upper chest flows downward toward the heart. On the other hand, blood coming from the lower extremities must flow upward. To make this possible, nature has provided valves in the veins so that the blood can flow only toward the heart, never in the other direction. In your legs you have 2 main sets of veins. The deeper veins are located within the muscles where they are given good support. But the veins on the surface just under the skin have little support and are easily damaged. These surface veins are often subject to inflammation, or phlebitis. In some people the veins in the legs are weak and may swell easily. Varicose veins, as this ailment is called, seem to run in families. Then again, anything that increases the pressure in the pelvis or abdomen may slow the flow of blood back to the heart from the lower extremities. One frequent cause of varicose veins is pregnancy, another is obesity. Anything that increases the pressure within the Varicose veins 271. Veins of the legs and thighs may weaken or break down the little valves, so that the veins become enlarged and the blood does not find its way back to the heart as it should. Varicose veins are ugly, and sometimes they are dangerous. A blood clot forming within a greatly dilated vein may break off and travel to the heart and lungs. This serious condition, known as pulmonary embolism, may actually cause death. Serious hemorrhage may occur if a large varicose vein is torn open or cut. Some people have actually bled to death, not knowing what to do in such an emergency. Steady pressure over the bleeding point, as suggested on page 111, will usually control the bleeding. But one should avoid such a danger by having the veins properly treated or removed. Signs of trouble: people with varicose veins first note swelling along the course of the veins, followed by muscle cramps and a tired feeling in the legs behind the knees. In some cases the skin over the lower part of the leg may break down, forming a large, ugly ulcer, which is often painful, especially when thrombophlebitis develops in the leg. Treatment: in most cases surgery is the best treatment, especially when the larger veins of the legs and thighs are involved. Long. 272 diseases of the blood vessels. Tortuous, winding vessels can easily be removed by vein ligation and stripping. Smaller veins can often be successfully treated by injections. To avoid further trouble, one should not wear any elastic bands around the legs, for this will only increase the problem. Special stockings and elastic bandages are useful as a temporary treatment, but they are not comfortable enough for regular use over a long period. Varicose ulcers need special care. The patient should rest in bed, with the legs elevated so that the heel is higher than the knee. Antibiotic ointments are useful in treating the local cellulitis or inflammation. Also, the heating cradle, described in the appendix, will help to protect the leg from further injury, and the gentle heat will help to heal the skin. Some ulcers do better with moist heat, others with dry. Both methods may be tried. Keeping the leg elevated will reduce swelling by helping the blood return to the heart. Large, deep ulcers and badly scarred areas may need a graft of fresh skin over the area before they will heal completely. Buerger's disease. Buerger's disease is a painful disorder of the toes and feet. It is most commonly seen in younger adult males. Excessive smoking is the most frequent cause of this painful disease. The patient usually complains of coldness, and tingling or burning in the feet or toes. In rare cases it may also involve the fingers or hands. In the early stages this discomfort is usually relieved by a period of rest, but quickly returns with mild exercise. The toes and feet appear red or dark, while the skin above may look more pale than normal. Gangrene and ulceration may then develop. Treatment: the patient must abstain from the use of tobacco in any form for the rest of his life. He must also avoid extremes in temperature and injury from poorly fitted shoes. Fungus infections of the feet should be treated, for they will always aggravate the condition. Complete rest in bed over a sufficiently long period may allow the ulcerated areas to heal. These special exercises should be carried out as part of the patient's general care. While he is lying down, elevate the legs at an angle of about 10 or 15 degrees and keep them there for 10 seconds, then lower them over the edge of the bed for 3 minutes. Let rest for 2 minutes with the legs lying flat. Repeat this routine. Effects of smoking 273. At least 10 times. Then allow the patient to rest. Do this at least 4 times a day. Anticoagulant therapy may also be tried, the dosage being similar that used for heart surgery. Again, we must repeat: any patient with Buerger's disease or other leg pains should definitely give up smoking and never again touch tobacco in any